Well, we just observed World AIDS Day, but the HIV crisis is far from over. Murray Penner of Prevention Access Campaign and Dr. Peter Scalar are here to tell us about a new survey that shows a lack of knowledge about the disease amongst millennials and Gen Zers. Hi, guys. How are you?
Great, Elsa. How are you?
So tell me, we've made big advances since the beginning of the HIV epidemic, but yet new HIV diagnosis rates remain high amongst young adults. Why is it so important to focus on the perceptions and the behaviors of young people in this survey?
Elsa, it's certainly these statistics that alarmed us and encouraged Merck to partner with the Prevention Access Campaign on a new initiative known as Owning HIV, Young Adults and the Fight Ahead. And it features results from a first-of-its-kind survey that looked at young adults and their perceptions, understandings, and perhaps misunderstandings about HIV.
What did the survey find about the level of HIV knowledge amongst the participants?
Sure. So I think the first area certainly highlighted some gaps in health literacy. So, for example, 2/3 of the respondents who were HIV uninfected were aware, and HIV was amongst their greatest concerns in terms of sexually transmitted infections. But there was a disconnect between that level of concern and then behaviors, as less than half reported using condoms or taking PrEP to protect themselves against acquiring HIV.
And what about the stigma associated with HIV? Did the survey find that that is still an issue now?
Yeah, I think Murray can speak well to stigma.
So yeah, stigma is certainly something that is first and foremost in this survey, very prevalent. 25% of HIV negative individuals millennials who we surveyed, didn't want to interact with someone who is living with HIV. And so I think it's a huge concern, and stigma drives a lot of challenges living with HIV. As someone who is living with HIV, I've been HIV positive since 1986. I've experienced this stigma a lot, and it's something that we really need to overcome in terms of helping our young people understand how HIV is transmitted and isn't transmitted, and also helping them encourage healthy behaviors, things like taking their medication daily. When I take my medication daily, I can suppress the virus to such a low level that it cannot be detected. It's called undetectable equals untransmittable. I don't transmit the virus to my sexual partners when I get to that level. U equals U, and it's an amazing advancement, but our young people clearly do not understand that. 31% of the people in this survey who are living with HIV didn't know about undetectable status. And so we have a lot of work to do, not only with education, but overcoming the stigma and the misconceptions that you can casually transmit HIV.
And tell me a little bit about the undetectable viral load and why that's so important.
So an undetectable viral load is really what we hope to achieve with modern medications. So this is a simple test that's done as part of really every routine visit when someone comes in for HIV care. It's a simple blood test, and we look to see if the levels of virus are really below the levels of detection of really modern assays. And so this is the goal, and thankfully with the advancements that I've certainly seen in the course of my years, and Merck's been involved in this effort for over 3 decades, it's really something that's very achievable for many, many patients.
And where can viewers go for more information?
So as this campaign kicks off in conjunction with World AIDS Day, people can learn more information and more about the survey results at owninghiv.com.
Murray and Peter, thank you so much for being with us. We'll be right back right after this.